my name is Teresa Powerski, and I'm the Area Director for Business Development for Civitas Senior Living. This month in August is National Immunization Awareness Month, and it is our mission to spread awareness and community education. Today we have the pleasure of being in the company with Dr. Kung. He is a board-certified family medicine physician, and he focuses on geriatric and palliative care for his practice. Thank you for joining us today.
Thank you, Teresa.
Thank you. So can you tell us a little bit about how you got started in geriatrics and anything new that you have happening in your practice?
Sure. How I got started in geriatrics was initially when I was in residency or medical student. I never really imagined I'd be in geriatrics, but you know, life throws us, life makes twists and turns, and you never know. One of the main reasons I went to geriatrics was my residency, my training had a significant amount of geriatrics thrown at me, and at the time it was a requirement, so like, it's a requirement, I'll do it. And then once I got out, unfortunately my dad had a very bad accident, had brain damage, and then from that he basically had memory impairments, and he had incontinence and a lot of other issues, so he became a geriatric patient. So, and he was one of the main reasons I kind of pushed into this field to help him out, and then doing so, I was like, wow, there's a lot of other families in a similar situation. And so he kind of spurred me into this field of geriatrics and how to help patients transition from the hospital to a home that's safe, whether it's home with their son and daughters, or assisted living, or getting their therapy back to a place where they can be independent, like in an independent living facility. So it depends on each personal patient's needs. I'm happy to say that this year, my practice, we're gonna implement some remote patient care. And so then blood pressure, blood sugars, all these will be remotely monitored, and certain parameters can be alerted if they're out of parameters. So that way we can keep our patients safe.
Great. So when you think of August being National Immunization Month, what comes to mind for you?
Immunization, so we're talking vaccines.
Big topic.
Yeah, big topic. It's going to be a lot of cover, but I'll try to put it all in to where it's more older adults focused.
Great.
One of the main things I think would benefit all older adults would be the shingles vaccine.
Sure.
Now, if you're older adults, you've probably been born before the 1980s. That means there wasn't a vaccine for chicken pox. So that means you had the chicken pox. And when you have the chicken pox, unfortunately, even if that means you always have a little bit of the virus somewhere, maybe asleep, dormant in your system. For most people, it doesn't cause any trouble. We don't have any symptoms. But for a few people, when we're stressed or a certain illness causes our immune system to go down, it brings it out. And the shingles, and when it brings out, that same virus that causes chickenpox will then cause tremendous amount of pain with rashes. And these rashes are usually on one side of the body. And if you probably heard, shingles rash can be very painful. And then for most folks, it can resolve with medication treatment, but some folks, it's a recurring. Once they have it, it starts recurring on a monthly basis or sometimes bi-weekly basis, and it's just very painful. And then once you start having all this, it's really treatment. There's nothing to prevent anymore. You're gonna keep having these flare-ups, these rashes, and this pain. And it can be very, very debilitating pain. And so if all it takes was just 2 shots and you never have to encounter any of this, it's a big thing. It's a life changer, because I've seen patients who are completely debilitated from shingles pain. And sometimes patients don't have the rash, but the pain persists after. And you really don't want to have that. And so I would really strongly push for it's called Syngrix. It's 2 injections, 2 to 4 months apart. And honestly, I haven't had any really bad reactions other than the usual soreness, redness at the area of injection, but usually it's very tolerated. And then you don't have to worry about ever getting a shingles rash or having the pain with shingles ever again. The next one, important for older adults, would be the pneumonia shot. And pneumonia shots, there's 3 different vaccinations for pneumonia, but the most important ones as an adult would be, if you're normal, healthy, it's really just 2 shots. One before you're 65 and one when you're after 65. And if you're over 65, you haven't gotten any pneumonia shots, then you can get both those series later, a few months apart, but you can get both of those. Actually 1 year apart, but you can get both those shots after 65, and then you're done. You're done. The only exceptions are if, and it's more important, is if you have like chronic conditions that can lower your immunity, such as if you have COPD, or you have diabetes, hypertension, or you have a combination of all three, plus maybe congestive heart failure.
Okay.
So those conditions kind of put you already at risk, so that when you get something simple like pneumonia, it really can cause you to have a hospitalization.
Okay.
That's why you see a lot of seniors where they just have like a urinary tract infection, but they end up in the hospital. While a normal working adult, you have a urinary tract infection, here's antibiotics for 3 to 5 days, and you go back to work the next day, if not. So the only difference is that when you have these underlying mobilities, it's like your comorbidities, it's like your body has already weakened, it's already extended its resources to deal with hypertension, diabetes, congestive heart failure, and then suddenly, and it's adapting, it's balancing it out, and then suddenly you throw pneumonia on top, it's like, I give up, and it breaks apart, and then you end up in the hospital. So the pneumonia shot will prevent that.
Okay, great.
And so that's why I think it's a big game changer.
Perfect, thanks.
If you do have comorbidities or chronic conditions, or that puts your immune system at risk, you can potentially get the pneumonia shot every 5 years.
Okay.
But otherwise, just 2 doses and you're good for life.
Okay.
MMR, or mumps, measles, and rubella.
Okay.
These we always got when as kids, and in the old days, once you got them and you have immunity, you're set for life. But recently, with all these little outbreaks here and there, and the thought of it that you got these shots when you're like 2 years old, 1 year old, and now you're 65, 70, 80. We have noticed there is a little bit in some patients waxing of immunity. Okay. Especially if you're traveling. If you're an elderly senior and you're traveling to other countries, it's actually recommended that you get an updated, just one-time shot.
Sure. Okay.
So just to kind of boost your immunity one last time, because last time you got it when you're 2 years old.
Sure, right.
So just one last time and you're good, especially if you're traveling. And I would recommend it just one time, because we see all these little outbreaks, and it's one of those diseases where you really don't want to have. If you ever remember you had it's kind of like chickenpox, but worse. You don't really want to have.
Right.
And then the next one is the usual standard, the Tdap, diphtheria, the ones where you step on a rusty nail and you get this bacteria infection, which can potentially lead to blood poisoning and kill you. So I know we're all wearing shoes and we're not really stepping on nails or anything, but it's once every 10 years, and that's what's recommended. So just one shot every 10 years and we're good. And it just keeps a peace of mind. If something happens, we're good. The next thing would be hepatitis. The CDC does recommend one-time screening for hepatitis for everyone. Usually in the past, hepatitis, whether A, B, or C, is only recommended for people in the healthcare industry, or if you're living in dorms or tight communities where you're exposed to a lot of people in a small area. But now they're kind of opening that more up to where they want one screening for everyone, and I think it's fair, it's good, and it's just a blood test, and it says, hey, you have yes or no, you have hepatitis. If you have hepatitis, there is treatment for it. There isn't any vaccine. There are only vaccination for hepatitis A and B. There isn't any for hepatitis C. Hepatitis A and B is usually transmitted by blood, body fluids, that kind of thing, or whoever prepared your food, maybe not be hygienic. But the good thing about hepatitis A and B is that it's usually very treatable and it doesn't last. Once you recover, you're recovered. But if you are vaccinated by it, then it greatly reduces the illness, and you may not even get sick at all. So if you are a senior, you go on cruises a lot, like every year, then you might as well just get
That's a good suggestion. Yeah.
Get the hepatitis vaccine.
Okay, great.
It's just 2 or 4 shots, depends on which type of vaccines you get, which brand name, but at least you're good. There isn't any vaccination for hepatitis C, but there is definitely medication treatment for it. So if you do it, you can see your doctor, there's medication cured. And you do want to screen at least once a year, and if you're positive, get treatment, because if you don't get treatment for hepatitis C, there are significant risk factors for cancer for hepatitis C. So that's one of the main reasons. And then the next one down the list would be the flu. This is further down the list because when the flu vaccination first came out, it was more recommended, kind of similar to hepatitis, more for those who are healthcare workers or those who handle blood, people work in a blood bank, or or those who are exposed to high risk needles, that kind of things. And then from that point, it kind of spread the recommendation out to everyone. But for me, I would say if you're a healthy adult and you're living in your own home and you're not mingling with a lot of new people, then you really don't have to. I mean, especially if you understand the flu vaccine is not, it's a sort of a guessing game, and what they do is they look at the last year flu strain, and from the last year flu strain, they try to develop a vaccine to guess or predict this year's flu strain. So it's not a perfect vaccination. That's why it's lower down the list for me, but it is a choice. There are some studies that say, they do reduce your risk of illness and the risk of getting influenza, but at the same time, if let's say they guessed that this year and you get a shot and it was almost nothing, and then you're like, I felt like I was more at risk by getting in line in the clinic with all these sick people and I get sick. So I understand the counterpoint, but at the same time, if you're in a community where you're interacting with a lot of new folks, and especially if you have, let's say, COPD or lung heart disease that puts you at further risk, and you hadn't had any bad reactions to it in the past, then might as well get it. A lot of times now, there are programs in which they will come to the adult communities, either independent living or assisted living, to give them the vaccination there, so they don't have to go to their doctors and be mingling around with all the other sick folks and get the shot and say, oh, I was sick because I was at the doctor's office.
Right, exactly.
So I would say, to me, it would be more of a personal choice. But if you're in a facility that really pushes it, recommend, then that's something you have to think about. Last on the list, a little bit controversial of all things, would be the COVID-19. I feel like at this point, everyone would already probably have COVID one way or the other. So I would say at least get your first 2 shots and be done with it. Boosters wise, at this point, since it's been circling around so much, I don't really see the benefit unless you're immunocompromised and you speak with your personal doctor and he says that your situation would recommend the boosters. But with any new drugs, we really don't know the full extent of it until we have years to look back on it. So if you're healthy and you already got your 2 shots, I say you're good.
Great. Yeah, thank you. That's very helpful.
The last one would be traveling. There's actually vaccinations. If you travel a lot into certain different areas of the world, the CDC actually have guidelines. If you travel in certain regions, there are actually specific vaccines for those regions. Let's say certain regions near swamp, tropical areas, you get malaria, they can recommend either certain medications to bring with you, prevent that, and then there's also certain vaccines to prevent, let's say, yellow fever or other, or dengue fever. There's a lot of different tropical diseases. So if you're traveling, so these are traveling vaccines. So that'll be last on my list, especially if you're traveling a lot and you just want to be extra careful, or especially if you're going to go off the cruise boat and wander into a jungle to see the waterfalls and stuff. Then check with your personal doctor. He can recommend, or there's actually certain doctors that would curtail to the traveling and vaccination.
Oh, okay. Well, thank you all for joining us. Feel free to like the video and share with your friends. If you have any comments below, feel free to add those into the box and we will respond. Thank you so much and have a great day.